Okay, so we're on page 7 in your handout, and we're going to the Ober's test position to test the TFL IT band. I know it was also done in Thomas test, but this is a more accurate way to really get a look at the TFL and IT band, the length of it. So the TFL IT band, this is obviously a flexor abductor. We're going to take the hip into the opposite actions. So for this, now my patient has to be completely relaxed. So my hand hold, so watch this hand hold. And I have her draped for modesty, of course. She's not modest, right? So I'm going to have my hand hold. I have her tibia tucked between my arm and my thorax, and I have my hand supporting her, and actually my fingers and the front of her leg here in the anterior portion, so that I can pull back into extension. So we're going to have some stabilization happening at the pelvis, and I'm also going to bring her back into extension as far as her hip will allow me without going into a lordosis. So you see I could go into a lordosis. I'm not going to do that. I'm stabilizing at the iliac crest. I don't want any rotations either, and I'm pulling her back, and I am allowing her to drop, if she can, below horizontal, which she does. So I'm testing, right, the muscles on the lateral side. Okay, so again, stabilizing the pelvis, pulling back into extension, and allowing her to drop closer to the table in adduction. And she drops below horizontal, that's a normal result. So if she didn't, if she was tight, she would be up here in abduction, or just getting to that horizontal and not dropping. So short would be in line, neutral, or not dropping, staying horizontal, not dropping. So that is the Ober's test position. The other way you can do it, if you are stretching this muscle out and you want to see if you've created any gains in the muscle and tendon, like goniometer's over there, but that's okay. So if we drop into adduction, we can always measure from the medial knee to the plinth. And as we get closer to the plinth, see, she gets really close if I push a little bit, that means that we created more length, okay? So you can always use your goniometer, and you can use the measurement in inches and see how close you're getting. So that is Ober's test position. Ober's test position. There is a modified Ober's if we have patellofemoral pain or dysfunction, and the flexion in the knee with the hip extension has the patellar tendon and quad tendon creating pressure in the patellofemoral joint. We can always leave it in extension, okay, and hold it in extension and do the same test again. So I'm still, pelvis is still stabilized, and I'm bringing her without rotation back, and I'm allowing her to drop. The weight of the leg definitely helps this part of it. It's a little bit easier, and she goes down even further, okay? So that's also a normal Ober's test, okay? She's not tight. All right, the next one on your list is hamstrings at the hip. So normal for this is 70 to 80 degrees flexion. So I'm going to have you go onto your back, okay? Face up. Okay, so for this one, can you flex that? Okay, good. I'm wondering if you'll have any back pain with this. Normally we have the lower extremity extended. Let's just see what happens. Okay, and we are actually flexing with a straight leg raise, just like so. If we see the leg on this side rise, that's the compensation we're looking for. And it does just so about here. So you can see it rise just a little bit. It's hard to catch, so we're looking right here, camera. So I'll start again. If I'm down here and I'm doing a straight leg raise to measure hamstring length on the right side, you can see it lift right here. Okay, so I'm going to stop before the compensation and measure exactly what the hip is giving me in terms of flexion. Let me get my goniometer. Let's put that down for a second. Okay. So I know whereabouts she had the compensation, but I'm always looking forward for it. I'm going to palpate trochanter. Thank you. I'm going to have it at the midline of the thorax. Okay. and of course in line with the femur and the epicondyle. The key is to locking out the knee and stopping with the compensation. So I don't have to hold this right now. I want to get to where I need to go in terms of where is that compensation. You okay? Yep. Does your back hurt at all? Okay. Make sure she's relaxed. So right there. Okay. I see my compensation. Now I'm going to take my measure. And here is my measure. Okay, so we're reading this side of the goni, and it's going to be just almost to 50, it's 49 degrees. So we went from 0 to 49. Okay, now normal is anywhere between 70 or 80 degrees, and so we know that Deb's right hamstrings at the hip are short. Okay, now there's 2 more tests for the hamstring, so this isn't the only one. The SLR has to be done at the hip. Okay, and then we have 90-90, and we also have the extension. So I did the SLR, which is your number 3, and now we're going to go to the 90-90. So these have to be done how they're done in the chart previously. You have to reassess the same way. You can't do a 90-90 if previous SLR was taken. It won't match, and you can't reassess and compare. So 90-90 hamstring test is exactly that starting position. So for a starting position of 90-90, we're going to be here. Okay, and letting the patient relax. The lower extremity on the opposite side is still extended. I'm going to come up into extension with her knee. I'm still looking for the rise in the opposite extremity, or tension, if I don't get a rise there, tension in her muscle and the length. So how are you feeling there, Deb? You feel tight? It feels tight there. Okay, so she didn't quite compensate as much, so relax, relax, relax. Let me do all the work. I think she's trying to hold her leg down. So just completely relax and let me take it. Take it into motion. Just relax, 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 relax. There it is, right there. I can see it raised just a little bit. So I'm going to see raise here. So she compensated. I'm going to stop here, and now I'm going to measure. Now we're working towards 0 here, and I'm making sure I'm in line with the lateral malleolus. I'm at the epicondyles for my axis, and in line with the femur, of course, to the trochanter. Now, here's the measure. We didn't quite get to, we're trying to get to 0 here because we're going towards extension. Now, we did not get that far to -40, so again, zooming in, if I didn't get to 40, which is still negative, these are all negative till we get to 0. If I didn't get to 40, which is normal, -40 to -30, that means I have a short hamstring. So right now, I'm looking at -46. So that means we're 6 degrees away from normal. If she was normal, I'd get closer to 0, closer to 40. That's my first normal measure. And then all of the rest is normal. So all of this from -40 to -30 are all normal range. So whether you're -38, 37, 36, 39, 32, whatever it is, that's all normal in the 30s, but it's a negative number because, again, we're going towards 0. The thing about this one, I know it's a bit confusing, so play with your goniometer and look at it. As we're going towards 0, she would be getting longer. So if I was able to go to -20, that is a longer hamstring length than -30. This is important. -10 is even longer hamstring length than -20 or -30 or -40. So the closer I get to 0, the longer the hamstrings are. Okay. Again, if we don't quite get to, if I'm here at -60, -55, -50, I didn't quite get to -40, I am having a short muscle length for hamstrings 90-90. So make sure you look at that goniometer correctly. Okay. Hamstrings at the knee. So for this one, we know that hamstrings at the knee should be 0. You can stay there, Shine. That's fine. Just be careful with the stairs. I'm going to create a little bit of space in case she goes into Recurvatum or she goes into a positive number. So just as you did, this one you did in goniometry, as you extend out the knee, okay? Make sure, I'm putting the towel here so I can clear the gastrocs to give her room if she's going to go down. I'm going to just come up just a little bit more. Okay. So right here is where I'm looking. So if I put a little overpressure, she actually can go into a little bit of Recurvatum. So I'm going to line up my goni. Try to stay out of your way, Shannon, so you can see it. Okay. I'm still lining up the same way. So I'm finding her epicondyles and I'm lining up at the lateral malleolus and the trochanter here. Okay. So right now she's 0. Perfect 0. If I put a little overpressure, she can go into that positive number. So now that we've gone past 0, she is a positive 3. So if you could see that right here, it's positive 3. If we didn't quite get there, now this is a great measure if we really truly have a knee flexion contracture. Somebody would be up here, not being able to get to 0. That would be a negative number, negative 19, negative 18 here. But as we get towards 0, this is all negative, so as I bring her down, it's negative, 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 till we get to 0, and then we have positive numbers after that. So again, as we go to 0, if we don't quite get there, it's negative. Okay, great. So those are your hamstrings. Your quadricep, just keep going here. Quadriceps, you've done in goniometry as well. Okay, so again, we're not so much the rectus because it crosses the hip joint. We're looking at the rest of the quadricep muscles here, the 3. So bring those back in your mind. You need to know those, name them. If I go into knee flexion, okay, I'm measuring those 3 quadriceps. So your vastus, your medialis, your intermedialis, all the vastus is here. And my knee flexion measure, I'm going to put some overpressure here, okay? All right. She's getting to 150, so she's definitely long. Okay, she gets to 153. Oops, hang on one second. I want to do that again. 152. Let's say 152. All right, so that would be long for knee flexion, only by a couple of degrees. So 150 is your normal length here. Okay. All right. So moving to the ankle, we have number 7 is soleus, 8 is gastrocs, and then we have spine. So I'm going to go for my small goniometer, okay, for my ankle measure. So with your ankle measure, Deb, if you want to prop up and sit up, long sit, like we call it a long sit if the patient wants to look at what's going on, and just come this way just a little bit, inch down off the table. Perfect. Okay. So I just want to clear the calcaneus so that I have a little bit of movement there that I can do, and I can sit down for this one. Okay. So for soleus was first, yeah. So for soleus, actually, yeah, I'm gonna have you come even further down. Sorry. Yeah, you can sit up. For soleus, I want to create flexion in the knee, and I want to create enough flexion in the knee so that gastrocs doesn't get in the way. So whether it's a towel, a pillow, I would say at least 60 degrees is going to take out the gastrocs in this measure, which is what you want. So we should get more dorsiflexion. So if I have her relax and I push into dorsiflexion, this is going to be my soleus measure. If the knee was straight, it's going to be my gastrocs measure. It's going to be less. So normal is 20 degrees of dorsiflexion for soleus. Normal for gastrocs is 10. So I'm going to line up my goniometer. Okay, so I'm distal to that lateral malleolus. I'm in line with the 5th metatarsal, and my stationary arm is in line with the fibular head. I'm going to make sure this is in line. Remember, and it doesn't matter how distal you are, as long as it's in line. This movable arm is where people get into trouble and the measure doesn't come out right. So I'm pushing, 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 making sure her leg doesn't move, making sure that's parallel. And we're looking at the red. You can look at the red or look at the black numbers and you know, deduct, but we're at, are you doing okay? I'm doing a lot of pressure because the Achilles tendon is big and kind of hard there, firm there. Okay, I can get 20 degrees. So if you could see, either you're looking at the 70 in the black number or you're looking at the 20 in the red number, and that's your 20 degrees, okay? So this is neutral. So 0 and 90, remember, is neutral. If we didn't get there, and a lot of people have tight soleus tight gastrocs, I would be in a negative number down here if I didn't quite get to the 90 and the 0. So negative 3, 4, whatever it is, as I get to here at 0. Now I'm in the positives as I go towards my normal, which is 20. Okay, so all of this is positive. Great. So now if I just want to do gastrocs, it's the same exact thing, except I want to make sure that the knee is straight and extended, because now we don't want the soleus, we want the gastroc measure. And that gastroc crosses the knee joint, so we have to have it extend out. So now we're going into our dorsiflexion, and she's even long here. She is at a 13, looks to be a 13. So we know normal is 10. So if we're at I know I moved it, but she was at 13. So there would be your measure for gastroc. So she's long. Normal is 10. Great, thank you. All right, last but not least, I'm going to go to spine. Okay, so I'm going to have Deb get up for me. All right, thanks, Deb. And I'm going to put her in a chair. You could stand right behind me. And just face the door. Perfect. So, and I would put a towel roll here. Always put that lumbar support for your patient if you have it. And for our goniometric measurements for your upper trapezius and scalenes, which is next, number 10, okay? For this one, you want the involved extremity, or I'm saying the involved side, the extremity has to be anchored. So we don't want any elevation here of the scapula. So what I'm going to ask her to do is, if I'm going to take the right side, I'm going to end up laterally flexing away, because remember, the O and the I are here. I want to separate them as much as I can. I'm going to ask her to hold on to the chair and don't let her shoulder move up, okay? So she's anchoring herself, and for this one, I'm just going to kind of passively take her and let her help me, because you don't want to manipulate the head and the neck if you haven't had a proper eval. So I'm going to allow her to do the motion, and I'm just going to make sure she doesn't rotate as she does it. So I'm going to ask you to bring the side of your head closer to your shoulder, so kind of ear to your shoulder, but don't turn at all. And you tell me when you need to stop. Just keep going if you can. Is that it? Okay. Okay. So now she says, that's it. I'm just going to quickly look and make sure she's not rotated, because sometimes from the front you could see where the chin ends up and rotation happens. She did pretty well. So now I'm ready to take my goniometric measure, my stationary arm pointing towards the floor. I'm looking for C7 for my axis, of course, and my occipital protuberance is my movable. Okay. So she is 22 degrees. So if you can see, we're looking down here, all right? And normal is 45, so we're not quite there yet. It would be here, okay? So she is 20, again, right here, 20, well, I'll give her 23 degrees. 23 degrees. Okay, thanks, Deb. So for her right side, again, we're moving away from the anchored shoulder, okay? So her right upper trap scalenes would be short, would be 23 instead of 45. All right, Deb, can you scooch this right butt up against here, but stay the way you are? Yep. Okay, so for the next and last one, I'm going to do her left side. Can you put your left arm here? Is that okay? Okay. Just rest. So rest. So now she doesn't need to anchor the shoulders. We're going to take out the scalenes and the upper trap here, and we're doing levator scapula. Now, it's again the same. I'm going to ask her to do lateral flexion away from the side that is positioned. Again, we're causing the lateral flexion to give length. So she's just going to bring that head closer to her right shoulder now, okay, without moving. And check that she's not rotated. She's not. She goes up just a bit. Okay, all right. Okay, try to do that again. As far as you can go. Allowing the patient to do her own motion on this one. Okay, so same and the same. So for her lateral flexion, she's got a longer on the left side, about 31 degrees. Again, okay, right there. So we went from 0 to 31. Okay, relaxed up. Thank you. Okay, so she is short. Levator scapula should be 45 again. So both of these lateral flexions, same degrees as normal, and she was short. So 45. All right. Now it's up to you to practice your objective data. Thank you.